Good afternoon. My motivation for starting City HealthWorks came from an unlikely place. I'd spent a few years working in India and Africa, where I saw firsthand the power of community health workers in addressing major health crises like HIV and malaria. When I came back to the US, my husband started residency in medicine in East Harlem, and I started asking questions about what happened when his patients went home from those short visits. I started learning more and more about the disparities in care in low-income neighborhoods in New York City. And just to give you some perspective, residents of East Harlem have a life expectancy rate that's 10 years less than folks who live in Midtown Manhattan. And this is New York City. As I started digging deeper and deeper, I realized that the global concept of a community health worker could work very well in the US, and decided to adapt it to our complex US healthcare system and to show that it made good business sense. We launched our operation here in East Harlem in 2013. At City HealthWorks, we primarily target the elderly in these neighborhoods, folks who have multiple chronic illnesses, who struggle with depression, the stresses of poverty, and incidentally, the folks who need the most help also tend to cost our health system a lot more. Half of our healthcare spending in the US is actually on just 5% of our population. Some of the big drivers behind this are the fact that many of the people we serve can't communicate well with their clinicians because they don't speak English, or no one ever really explained how to notice a symptom until it became a crisis. Secondly, our health system rewards volume of services delivered, not the value. And so clinicians are not paid for the time that they spend trying to make sure that someone actually understands how to eat well or how to take their medications properly. Third, the majority of activities required to manage the day-to-day realities of living with a chronic illness take place in the home. And for most clinicians, even the most well-meaning, the home is a black box. Ushered in by health reform right now, the US is investing unprecedented levels of public money in the redesign of how we deliver healthcare and how we pay for it. To help deliver on the promise of reform, at City HealthWorks, we've built a systems approach that amplifies the reach of overburdened clinics in low-income neighborhoods and strengthens the abilities of patients to better manage their own health. It first starts with our people. We screen for individuals like Evelyn Cruz, one of our health coaches, neighbors who are rich in life experience and have a strong ability to empathize. We then train them rigorously in motivational counseling and disease management skills, provide clinical supervision, and review their performance regularly. For our health coaches, this is a rewarding career path in healthcare with a competitive salary. They then go meet with people primarily in their home and explain and help individuals understand what's going on with their bodies and set realistic goals within the circumstances of their life. Along the way, they uncover very important pieces of information, like an elderly adult recently who shared that he was scared to take his insulin shots because soon after his wife started taking them, she had passed away. Or a grandmother who's been cycling in and out of the emergency room because she's visually impaired and didn't see the mold that was developing in her apartment. Our health coaches have this very unique insight into the lives and the homes of the patients they serve. And for doctors, they can serve as vital eyes and ears. For 1 in 2 patients that we've met in the past 2 years, we've identified a critical medical issue that would have otherwise gone unnoticed, and half of which would have resulted in an emergency room visit at that moment. This works because we built a staffing model and a technology that closes gaps in care between clinics and the people they serve. To ensure we deliver the best quality care possible, we've created a technology that collects and shares information well, data analytics that help us make smarter decisions, and quality improvement systems to make sure our processes keep getting better and better over time. As the US healthcare system continues to reimagine how we deliver care, City HealthWorks has a unique window of opportunity right now to demonstrate the value of adding extra support for those who need it most, because it does not only save money, it saves lives. Thank you very much.